people. This is my sister Laura.
Hey, this is my sister Jean, and we're the Reclamation Sisters.
So I think today it would be important to talk about MAT. Do you know what MAT is?
I don't.
Medicated assisted treatment or medication assisted therapy is something that was originally stigmatized, but now in the forefront, many states are working to provide opportunities for medication in the recovery process. So there's a whole bunch of medicines. And of course, this is a super non-medical, person-centered approach to what all of this is, because you would want to talk to your medical provider to get true medicine-based information. But it's important to understand, because you might have somebody in your life that's on a medicine and you're like, well, what does that mean?
Yeah. So for somebody who's not a non-user, we might look at that and say, well, how is that helping you get better if you're just taking another drug to get off of a different drug?
Yeah, it's like a placebo, some people think of, or you're still using. There's so many different misnomers about what this process is. So originally, many, many years ago, they came out with methadone. And a lot of people hear about methadone. And that is a drug that is given and dispensed from a clinic. And they get medication every day at a certain time, and it's given out, and after a while they're allowed to take it home if they earn that right. But it is a controlled substance. What we need to know about methadone is it's not that they're not capable of getting well. They have underlying issues and an addiction that needs to be addressed in a long time frame. And some people may never come off of methadone, and that's between the provider and the person engaging in the medication dispensing. And so we need to realize that the purpose of it is to keep them off the street from using poison, using IV needles, putting themselves in situations where they are at risk for charges or assault or danger in any way to themselves. So it is a liquid, and it's dispensed in different doses. Basically, the concept is you have a mu receptor in your brain, and that mu receptor is fully open. That medication is fully received in your brain. It produces the same sort of euphoric sensation. It's an opiate receptor. And so what happens is that person is then able to not feel sick, because people on opiates that are withdrawing feel sick. They feel this need to continue using so they don't feel ill. So it takes away that initial illness. It reduces the craving. Then they're able to engage in a process of therapy and integrative treatment, like we talked about before, that whole person healing. And so that's methadone. It's like one of the first things that people know. Old school, we would only have heard about antabuse, which was for alcohol. And from those two things, medicated assisted treatment has blown up, and now there's support groups for people on MAT, like NA. There's a MARA meeting for people who engage in that.
Now, why would they need their own steps, their own group? Aren't they still people trying to recover?
Right. So one of the important things to understand is, like, in AA, it's people who are addressing alcohol. In NA, it's people who see that no use of any substance, alcohol or a drug. Alcohol is a drug is a drug, and anything you're using impedes your ability to get well. And for a long time, there was, again, here's our favorite word, stigma attached to using some of these drugs, whether it was methadone or one of the other things that I'll explain to you. So it's almost like we stigmatized our own people, and so they have their own support group. Just like many groups need that individual ability to talk about their current concerns and their needs. And if you're not using anything, it's hard to understand somebody who needs to use something to get well. But again, if we look at other illnesses, we don't just not give people medicine. If I have cancer, you're going to say, why wouldn't you take your cancer medication, or whatever the doctor says. So these medicines come from a medical provider. You are under medical care and in treatment. So we started with methadone. Then we have, for opiates, we have several new ones. There was originally Suboxone. And then,
I've heard of that one.
Yeah, it's the strips. There's lots of conversation about Suboxone. It can be abused if not regulated. Now they have a secondary drug in it that makes there's like a ceiling effect to it. It's harder to abuse. It's dispensed in shorter periods now, and you have to check in with your doctor more often. There's a lot of federal regulations that help to keep it so that it's not abused. But you have Suboxone, Subutex, Zubzol, Sublocade, and they are, your mu receptor is basically got like a net over it, and your brain only receives part of that drug. It's a partial agonist, whereas methadone is a full agonist. So fully receiving, now I'm partially receiving this drug. So I'm further into the process of getting well. Okay. I'm still struggling. I have the ability to navigate a little better. I've come through the detox period, and now I'm maintaining my life, but I have great cravings. My distorted thinking might still be strong. I may not have full support set up. I may not have peers that are understanding. That integrative approach that we talk about may not be fully in place yet. And so any sort of distortion in our life would cause us to seek out the numbing. Mm-hmm. And so that reduces that need to use street level substances. Okay. It's a clean substance, and it allows us to navigate. It also allows the person who's using those substances, whether it's Zubzol, Sublocade, Subutex, or Suboxone, to participate in programming and address those underlying traumatic experiences so that they're not running to heroin or another substance to address those traumas. So full agonist, and then we have partial agonist, and now we have something that is like a blocker, and it's pretty magical in the world of substance abuse. So we have the ability to kind of seal off the mu receptor, and for great periods of time, which people are like, wait, what are you talking about? Yeah. So we have what we call Revia, which is a pill version of it, and Vivitrol. So Vivitrol is like you get a shot, boop, you get it in your backside, and it lasts for 21 to 28 days, depending on your cycle. You might have to have some medical tests done first. Make sure your liver enzymes are good. You don't have bloodborne illness, hepatitis type issues, and that you don't have deterioration of your liver from drinking, things like that. So once we establish your medical baseline, we're able to say, we're going to see how you respond to this. We'll give you Revia for a few days. If you do well on it, between 3 and 5 days, then they'll move you into an injection, and then it blocks that need. But the difference between the first two and the blockers is it not only blocks an opiate, it reduces cravings to other substances, and it blocks your ability to absorb alcohol.
Wow.
Right? So what used to be anabuse, and you would get sick if you drank, this kind of is like super glue in your brain magic, and it's super neat. The idea of using it in alcohol related issues is to reduce the number of drinking days. We're not saying, hey, you can't drink. We're trying to make it so that we can reduce those days that you drink so that we can work with you to address underlying issues. Some people go on it and they never drink again. Wow. It's not something that's used long term. It might be used for 6 months to 2 years. People are then able to establish this recovered life, which is the whole goal, to provide them the ability to not constantly be in crisis with their substance. But medicated assisted treatment also addresses other things. Remember when gum came out and you would they had all the ads for nicotine gum? Yeah. Nicotine is a diagnostic disorder, and you are addicted to nicotine, right? So they have medication to help you come off of that. And that's often like the last thing you would address, because you're not supposed to stop everything all at one time. So they have Chantix for stopping use. They have Wellbutrin, which has multiple uses. It's a mental health medication that reduces cravings. They have nicotine patches that you can start at a high dose based on what the amount of nicotine you consume a day. And as you stop smoking, step down to lower doses. They have nicotine lozenges, nicotine spray, and nicotine gum to help reduce those moments when you're like in kind of anxious state. It helps you to move through another type of addiction. So lots of medications that people don't realize are part of the therapeutic process. But the problem is a lot of people stigmatize these things. So I think it's just really important that people understand that therapy is often inclusive in that integrative approach too. Also medication, and that we cannot say to somebody like, well, you're not clean because you're taking a medicine. Yeah. Well, you have cancer, but you can't take chemo. So we have to understand that in providing support for our family members or the people in our lives, that there's going to come a time where some people are going to be on medication, and that we have to have conversations with, how is that medication helping you? Do you need a different medication? Are you taking your medication as prescribed? Because these are drugs, and so you are introducing those chemicals to your body, so you have to be forthright about your use. Is somebody abusing that medication? Are they not taking it and distributing it for other purposes? That's why it's so important to have that family component or that support system who's providing that kind of a level of accountability till you can stand in your truth and say, I'm doing this for my own path to wellness. Originally, there was no medication for cocaine addiction because they're typically created for people who have extreme withdrawal or that would put them into a detox setting. But with like cocaine, you don't go through a physical withdrawal that has to be medically monitored. I mean, you withdraw from the substance psychologically and physically, but there's not a need to block that chemical. So now we have things that are like, well, I won't try to say the word because it's this long, but they call it NAC, N-A-C, and you can get it at your local health food store, and it helps to balance out your brain and heal that brain process. There's also medication that is more like a mental health medication. It works to address the synapses and the neurons and the dopamine levels and things like that, which is what we understand mental health medication to do for alcohol. And so that's acamprosate or diflsum. And those medications can also be used in accordance with other blockers or medications depending on. So you might block with Vivitrol for alcohol consumption and reduce number of drinking days, but then you might also add acamprosate to shift the way your brain is currently functioning. So an important topic, make sure that you're talking to the people in your life about where they are and what they're taking, and have an understanding. You know, are you on mental health medications? Are you on MAT? Are you compliant? Are you going to therapy? Because it really does increase the likelihood that someone can be successful and not struggle so much.
What kind of professional can prescribe these things?
So there are MAT providers. Currently, the clinical supervisor of a program that provides MAT. So our people are onboarded, and they have a nursing assessment and they have a medical assessment, and then the medication is prescribed by an MAT provider, which can be a doctor or a psychiatrist. So there's a lot of things that go into it. There's levels. You have to have your UA done, your urinalysis, to make sure your levels are right and that you're taking it as prescribed. So we have a whole medical department. You aren't going to just go to your regular doctor and say, hey, I need methadone. There are methadone clinics. There are Suboxone clinics. We have a Suboxone and Vivitrol program, also with nicotine replacement in my program. But it is monitored through several types of providers dependent on the type of medicine you're on. Now, you can get nicotine replacement, MAT, from your family doctor. But the other medications are through regulated programs. So you would need to look per state for the regulations. In Pennsylvania, there are clinics. In New York State, it's part of outpatient clinics. There are MAT clinics. And you get onboarded into these programs very quickly. Regulations say we have like 48 hours once you call and ask for help. And you can also go to your local emergency room in some states and say, like, I would go into withdrawal, I need something, depending on New York. Buffalo area has clinic connections. They have a computer that says, hey, we'll give you this much medication so that you don't continue use, but you have 5 days to onboard into a program and be under the direction of a doctor. So lots of different regulations and needs that need to be met, but the ability to get those services is critical when you have somebody with certain substance issues.
And you said you, at your job, you teach an MAT group. Is that for people who are going through the MAT process to learn to cope with those medications?
So if you're in the MAT program, we would provide you information based on what each substance does, options related to stepping down through the continuum of care. You may struggle with a substance and find like an injectable is more successful. You have less likelihood of abuse with it. Then moving off of that and into just kind of intensive treatment or into nicotine replacement. Off of nicotine replacement, there's a lot of side effects with these. Like if you continue methadone for an exceptional length of period, it creates like almost like a coral-like effect in your bones, you become very brittle.
Oh my
you
gosh.
can have dental issues. There's havoc that's created. Like any medication,
Yeah.
there's side effects. So we teach what those side effects are. We teach the importance of peer support, fellowshipping, paths to wellness, addressing cognitive distortions, distorted thinking, underlying issues, trauma. So we incorporate all of the component. It's not just this medicine is the answer, because there are, like we say, a million paths to wellness, and we have to engage and do that kind of inclusive, integrative approach to wellness, because ultimately it's a path to wellness is what recovery is. And like we said, at one point you're going to address your job and then your family and all these things. Well, we address medication, and move you through. It's its own sort of continuum. So it's a lot to take in, but the value of it is innumerable. We can't do this without these medicines.
Well, that was great information from Jean today. Thanks for joining us. Please click the subscribe button if you found some value today. See you next time.
Bye. Are you trying to get the wrinkles in my neck in? Is that what you're trying to do? What?
I'll go water again.
Do you want a big, thing come crush your eyeball?
That's like the dog when we pick out the dog's eye boogers.
Yeah. Have you ever seen when they do it on a horse? It's
Ew,
like
ew!
terrifying.
Went to bed at 3 again.
Why?
Working on grad
School?
was that grad school stuff, and then I was creating more quotes for this.
I was sweating. I just need taste. I need taste, Nana.